But let's shift focus to the cause why the world is so risk averse, and perhaps one of the reasons why these precious metal prices are moving up the way they are. It is indeed the COVID-19 cases, and they continue to rise. In fact, in India itself, we've managed to cross the 60 lakh cases, but the recovery as well has been higher than 80%. So let's put really things into perspective as to where is it that we're headed in terms of measures to tackle COVID, the race for a vaccine. We have with us Mr. Pratit Samdani. He's internal physician and intensivist at Candy, Bhatia, Saifee and Jaslok hospitals. We also have with us Dr. Gautam Bhansali, chief coordinator at all private hospitals. He's joining us on the show right now. He's also consultant physician at the Bombay Hospital. Gentlemen, good to have you on the show. Morning, firstly, and welcome to ET Now. Dr. Bhansali, if I could start off the discussion with you, help us understand about the recent surge that we've seen in the COVID cases in India. The fact that we're now at the number 2 spot in the worldwide cases. Are we still in the thick of the wave? And more importantly, how much of truth can be assigned really to fears of a second wave actually emerging?
I feel this is what is going on. It may be look like a second wave only. Now, if you see the number of cases in our country is around 60 lakh cases. But if you see active cases are not that much. We are counting all cases from day one, like from the month of March to till now. So the patient people who have recovered, still we are counting in that figure. So I feel we should not go behind this number game. We are doing a second thing that we are doing maximum testing now. Like earlier, we used to do 4,000 tests per day in Mumbai. Now we are doing 20,000 tests per day. So out of 20,000, if cases are like 2,000, we should not be worried that much. Why? Because we are totally geared up. We are prepared with the worst come worst situation. Like there was a lockdown earlier. Now this almost lockdown is over. People are coming out, people are on road, people are in buses, local trains. Some local trains are started, and people are in flight, people are in offices, hospitals, everywhere. Now, earlier that non-COVID patients were not coming to hospital. Now, non-COVID patients like for the surgery, orthopedic surgery, cancer surgery, other kind of things, people are coming. So the number of cases increasing, but number of testing is also increased. So the purpose of the main lockdown was to educate people, aware people, and build the health infrastructure. Now we have jumbo facility in Mumbai where in one roof you have all kind of facility. All kind of facility means you have 24/7 RT-PCR test, which is free of cost. You are having remdesivir injection in that all jumbo facility. We have 8 jumbo facility in Mumbai. It is at par, or you can say better than private hospital infrastructure. We have good doctor, good team, all care like oxygen facilities there, ventilator facilities there. So if number have increased, we should not be that much worried. Why? Because health infrastructure is ready. Secondly, treatment-wise, things are ready, like remdesivir is now available. Earlier, there was a huge shortage of remdesivir or it was not available. Now remdesivir is available. That is helping us in the treatment for this COVID. That's why our mortality rate is 1.5%, which is minimum in the world.
Sure. Dr. Samdani, if I could get you into the discussion, you know, what Dr. Bhansali was saying, that testing has gone up, so have the number of infected. But with that, you know, India can really claim that the mortality or fatality rate also is much lower. Help us understand exactly at which end of the curve are we in? And are we in the first wave, or have we now moved on to the second wave? And are there any signs of peaking out anytime soon?
Well, from the data and from our personal experiences now in the city and elsewhere in the country, what we hear, that it does seem that we are peaking out. We are flattening the curve. We're probably coming down. If you see, the last 10 days have been more happier for us. The numbers are less. The mortality is reduced. Also, the large number of tests is actually, as Dr. Bhansali says, has caused large number of cases in terms of numbers to rise. But let me tell you, the type of cases that we had in March, April, and May, and the type of cases that we have now in August and September are pretty different. They're easily manageable. The mortality is much less. It's causing less morbidity. and large number of patients can be home quarantined and successfully treated. So the other thing is, if you ask me about the second wave of the curve, I am not confident to say that, we've started hitting the second wave. As things opened up, the festivities, the Ganpati festival, the trains opening up, the offices opening up, little carelessness on the citizen of the country not wearing masks, these are going to increase the cases in future too. So we have to keep our guards on. We must keep the protective thing on. We must wash our hands regularly, wear the mask regularly to prevent a sudden surge in the number of cases.
Dr. Samdani, Dr. Bhansali, and all doctors have been running pillar to post to keep all of us safe. So a big thank you on behalf of everyone from the Times Group. And Dr. Samdani, I have also interacted with you personally. So I know the kind of hard work you and your team is putting out. So thank you once again for that. Dr. Samdani, now the question is, where is the vaccine headed? Couple of weeks ago, it appeared that by December, we hopefully will get a breakthrough. But there is no update on that. Post the break. Now, even if we get the breakthrough by December or Jan, the whole question is that how soon the vaccine would be produced and distributed. So looks like the entire 2021, Dr. Samdani, is going to be a year where we all will not get a complete cure based on vaccine. So all the chances that vaccine would come and a magic would happen by April or March looks highly improbable.
Thank you, Anuj, for those kind words. Firstly, let me just take you a bit historically into vaccines. If we remember the smallpox vaccine in the 18th century, it took us almost 150 years to develop a vaccine. Today, the first vaccine that went into trial was within 42 days of the COVID hitting as a pandemic in the world. In terms of the vaccine, so there are basically about 45 vaccines that are under trial. 9 vaccines out of these are right ahead. Just to name a few, we have the Wuhan vaccine, which is a recombinant vaccine. We have the Oxford vaccine, much talked about the Oxford vaccine. It's a method where you have the replication of the deficient viral vector. So what they do is they take small genetic material, they take sections of this, code it, and then inject it into a harmless like virus into chimpanzees, and that's how you make the vaccine. So when this vaccine is going to be injected in humans, if it's successful in future, this vaccine, the body will act as if this is a virus and start fighting with this vaccine. It's actually not a virus. Then you have the Johnson & Johnson vaccine. That's a non-replicating vaccine. That's also under phase 3 trials. We have the Moderna vaccine. This is one of the first vaccines that had started to go under trial 42 days. And now they've enrolled a large number of patients, 35,000. They're getting good antibodies developed against the COVID-19. So we look forward to that. And of course, we have our own Covaxin, which is an inactivated virus type of vaccine. It's in the second phase. This is going to take time. Much talked about the Russian vaccine. Well, we need more data in terms of efficacy, safety. So the Indian government has tied up and we are going to, start seeing the antibody response. Any vaccine, Anuj, we must realize it needs efficacy, it needs safety, it needs sustainability. So you need to have efficacy against the disease. It needs to remain in the body for a decent amount of time. Some of these vaccines need to be given twice, once now and once after 4 weeks. And the antibody response should not get muted or plateaued or flattened. It should remain sustained. So that's important. Also, you spoke about the availability in terms of cold storage. So if you heard the Prime Minister of India very smartly and diligently, he said he's ready for a cold chain vaccine. So he's right on the war front, right on the front foot to get this vaccine out whenever it's available. If I go back historically 150 years, 6 months, we're very close to getting a vaccine. There's no comparison between the time limits. But I still feel it would be 2021, probably the early to mid part, where we'll successfully get a vaccine to help us protect. One caveat, a vaccine does not mean 100% protection. We need to see how much protection it can give us.
Okay, fair point. Dr. Bhansali, I'm coming to you and I'm going to take a leaf from what Dr. Samdani just said, that there is definitely a difference in terms of the COVID patients now versus earlier. What is your experience? Why the change has happened? And is the change for better, or the change could be, pretty much what we hear, that the virus which survives will get stronger, survival of the fittest. Are we getting better, or this is Darwinian's theory where mutation will only increase?
Yeah, Anuj, definitely we are getting better and much better. And why? Because we were focused on the change the virus policy. Testing. This was the main motive of this thing. That's why we have done maximum tests. And after that, patient is like whether they are the asymptomatic carrier, or symptomatic, or oxygen deficient, or patient require BiPAP or ventilator. Can I tell you, Anuj, one more thing, that 10%, hardly 5% patients require ventilator. Otherwise, maximum patients are treated with the high flow nasal and that BiPAP machine only. Second thing, why we are getting better? Because many drugs are available. Earlier, it's a new disease, new challenge. Every day there was a new guideline for everybody, for the doctors, for the staff, for the patient, everybody. Now, patients are also educated. Patient becoming asymptomatic, plus patients are so educated that they come on time, we start treatment on time. Like, we need to use steroid and remdesivir. It's a judicious, timely use, timely intervention, and judicious dose is required for the this kind of patients. Now, the drugs are available, like antiviral drugs are available in the market, which reduce the replication of the virus or viral load. That's why survival is much better now. Earlier, treatment was not available. That's why mortality was also a bit higher. And people were also not that much educated. So they were ignoring this virus. No, this is a fake virus, or this is something like that. We should not go to hospital. There were a lot of things was there. But now things are available. Testing is also available. And one thing I can tell you, that Mumbai was the first city in the country who introduced this policy that you don't require doctor prescription for COVID testing. Now in Mumbai is the only city in the world where this kind of things was implemented. Nikunj, yeah. So Nikunj, this policy we have made, and after that there was people are also becoming more and more aware. The treatment is available. That's why these kind of things are improving. So now I can say that if you are having COVID, you should not be panicked that much. Contact your doctor, check your pulse oximeter, check your oxygen saturation level. And one more thing happened, that now 70-80% people are educated. They know that what is their oxygen level. Earlier, nobody was knowing what is their oxygen level, what is their heart rate, what is their temperature. Now everybody is aware that what is their pulse, what is their oxygen saturation level, when to contact a doctor, when to go to hospital, and when oxygen is required, when medication is required. So a lot of treatment availability is there. That's why mortality is drastically reduced. Patients are becoming much better, and stand has also been changed.
Dr. Samdani, on the credibility of the tests which are happening, there is mass testing, at least in urban cities like Mumbai as well as New Delhi. But the correct rate of those tests is, of course, questionable. If one had to ask you as to what is the correct way of finding whether you are carrying the virus, symptomatic or asymptomatic, and more asymptomatic, is it the antigen test? Is it RT-PCR? Or should one just get an antibody test and that's the correct way of finding out whether you are a carrier or not?
I think this is one of the most important questions that you've asked for the day. And it's so important both for a medical fraternity as well as the common man here. So let me go ahead through each test. The antigen test is a specific test. The sensitivity of the antigen test is not that good. That means it's one of the first markers to come positive when you have COVID-19. It's to be done very early in the phase. It's a rapid test. The test results come very early. The problem is it's only sensitive to about 40%. That means 60% of the time you will not get a positive test. If the antigen test is positive and you take this patient as suffering from COVID-19, this positivity of 40 to 50% is only in symptomatic patients. So if you have an asymptomatic patient, you're highly unlikely to get a positive antigen test. Then we come to the swab PCR test or the polymerase chain reaction test. this is a very, very specific test and a very, very sensitive test. So all the labs that are doing the PCR tests, the test is done through a swab in the nose and through a swab in the throat. They're all ICMR certified labs. They've been trained, they've been shown way to collect the swabs and run the tests. Now, if you have a problem in collection, then you can have a false negative. There's nothing really called a false positive. The sensitivity again is about 65 to 70%, not 100%. So sometimes when you have a very high suspicion, you may want to repeat a swab PCR test. The third test that you asked me was about the antibody test. When an antigen, when a disease or an infection or a virus like the SARS-CoV-2 enters your body, it produces antigens. When this antigen gets converted, as time goes by, it forms an antibody after reacting with your body. That means the antibody test will only come positive at the earliest after day 10. So it's no use doing an antibody right in the beginning of the disease. In the antibody test, there are two parts. You have the total antibody that contains the IgG, IgM, and IgA. IgM for any disease, whether it's SARS or any other disease, means recent infection. And total antibody could mean old and recent. So if you have an IgM that's strongly positive, if you've done an antibody acutely infected, or you're seroconverting, that means you may be in the infective period. If you have the IgG antibody, that means you are probably past the infective stage and now you're developing antibodies against it. So these are important tests.
Doctors, both of you, thank you so much for taking the time out and speaking with us. It was a good discussion to really help understand what is the state of the virus, the infected cases, and more importantly, testing and the vaccine as well.
Thank you so much for having us.
Thank you. Thank you.